Hi, I'm Dr. Dean, and this is a short informational video on intravitreal injections. So intravitreal injection is what it sounds like. Intra means into, vitreal, vitreous injection, so it's an injection into the vitreous. Now where's the vitreous? So if you look at this diagram, this model, what you can see, I'm just going to take the lens and the cornea off here. What you can see is that this part of the eye over here is filled with vitreous. So an intravitreal injection is an injection into the vitreous. So we've got to get fluid into this part of the eye. And the reason we need to inject it into that part of the eye is that your eye has something called the blood-ocular barrier, which means that it restricts what goes from the blood into the eye. It's similar to the brain. Your brain has a blood-brain barrier. And what that means is if you take medication, antibiotics, analgesia, any medication that you take normally ends up in the blood. If it's in the blood, it goes throughout your body, to your heart, to your liver, to your skin, but it's very difficult to get to your eye because of this barrier between your blood and your eye, the blood-ocular barrier. And so that's why, unfortunately, a lot of medications that need to go into the retina or work in the eye need to be delivered directly into the eye and can't be used with other traditional forms of medication. So there's a variety of conditions that require intravitreal injections. The most common few are diabetics with diabetic macular edema and AMD, or age-related macular degeneration. When there's the wet form, when they have what we call a CNV, or choroidal neovascular membrane, then they require intravitreal injections. And there's a variety of different types and different protocols and how often we do that. But essentially the concept is still the same. And it always sounds very scary to the patients when they get told you have to have an injection in the eye. A lot of patients are very sensitive, and just the thought of that is kind of traumatic for those patients. But for the most part, it can be relatively atraumatic. I think often the idea of the injection is even worse than the injection itself. So just showing you on this diagram where the injection is and performed, you can see this is just a basic model of the eye. There is an area here called the pars plana. So the retina starts over here, and we know that this set distance is safe to put something into the eye. So this is the area that is injected, and it can be injected safely. So that's where the intravitreal injection goes. Just to show you diagrammatically where that is, you can see this is an example. This is where the needle is placed, and then fluid is injected into the eye over there. So it can act on normally this part of the eye here in the macular area over there. These needles are normally very, very thin and small, and the volume of fluid that is injected into the eye is very, very small. Just a drop of fluid that goes in. So it's a very, very small amount of fluid that goes into that eye. Obviously, if you are having an injection in the eye, we anesthetize the eye, and so this normally should not be a painful procedure. The first step is putting a drop into the eye. That's a local anesthetic that numbs the surface. Then normally a local anesthetic injection is done. So just on the surface, just on the conjunctiva, a very small amount of local anesthetic is injected under the conjunctiva. We call that a subconjunctival injection. And that causes that area locally to be completely numb, so you don't feel anything there. Once you've had the local anesthetic drops and the very small local anesthetic injection, and you normally don't feel that injection at all because the drops have been placed on the eye to numb that surface already. We then clean the eye with iodine, which is very important, and that iodine needs to sit in the eye for a few minutes, and then we inject into the eye. Normally we ask you to look down, but different doctors inject differently, but normally you get asked to look down, and the injection is placed over the area where the local anesthetic was given. And when that injection is done, you often feel nothing. Patients often ask, oh, have you finished? Is the injection done? Is it completed? So as I said earlier, it's often the thought of the injection that is way more traumatic than the injection itself. It's normally a painless experience. It shouldn't be traumatic at all. So And this is something that is very commonplace in ophthalmology. They are being done on a regular basis. Probably one of the most important bits of information that you need to know regarding an injection is the biggest risk or concern. Now, thousands and thousands of these injections are being done every day worldwide. And the biggest concern we have is infection after an injection. Fortunately, it's incredibly rare, but it's why we do it in a sterile environment, that we clean the eye with iodine, and we take precautions. But the risk still is there, and so what is important is if you have any symptoms after an injection, like deteriorating vision, an eye that becomes increasingly red, and an eye that is painful, especially if you get any eyelid swelling, or the eye closes shut, or discharge, any symptoms like that, to return to the practice or to consult your doctor straight away. Those infections are called endophthalmitis, and fortunately they're incredibly rare, but if they occur, you want to address them very promptly to prevent any serious loss of vision in the eye. So that's very important. In the first few days or 2 weeks after your injection, if there's any symptoms like that, red, painful eye with decreased vision, eyelid swelling, or a discharge forms, please, you need to contact your doctor or the practice, or return immediately to make sure that you can have a checkup. So it is a safe procedure, but you need to be aware of the signs and the symptoms so that we can address it in a timely manner. So that's the basics of intravitreal injections. I hope that was helpful, and if you need more information, please feel free to contact us.